Susan Brown here from the Center for Better Bones. You know, recently I went to the National Conference of the Institute of Functional Medicine. And what I want to do today is report back a little bit because medicine is coming our way. These functional medicine doctors are beginning to look at nutrition, lifestyle, even stress, and they are creating a whole new medicine, very much like what we have promoted here at the Center for Better Bones. This picture is of two young women from the Philippines. They're both doctors. They made the trip all the way from the Philippines to Florida to attend this conference, and they are actually in training to bring functional medicine to the Philippines. I was really impressed with the effort they're making to do this. One of these doctors healed herself from lupus, and they are great crusaders that are going to bring change in the Philippines. And we see the change happening all over the world. So you might say, what the heck is this functional medicine? Functional medicine is a type of medicine that looks for the root causes of the problem. Instead of saying, oh, you have a headache, let's give you a pill, or you have lupus, let's give you a prednisone, they say, let's find out why there's a problem. Let's look at nutrition. Let's look at the burden of toxicity, which is so great between the metals and the pesticides and the plastics. They pay a lot of attention to this. Let's look at how the body is metabolizing things. And you know, one of the major topics in this conference, this whole weekend, was the microbiome. This bacteria in our intestine that is most of our cells are bacteria. 9 out of 10 cells in our body are bacteria cells. We have zillions of bacteria in the body, and they do many important functions. Many of the discussions at this meeting was about how to make a healthy microbiome and how that microbiome affects your overall health. Not only your digestion, but your immunity, your thinking, everything. You'll be learning more about that. But functional medicine, I like this tree illustration. You actually talk about the roots, and then you go to see the symptoms. The roots can be things like sleeping and relaxation, if you have a lack of that, if you have a lack of exercise. The nutrition can affect its stress, and even our social interactions. If these are in balance, we have wonderfully good systems, neurological systems, endocrine systems, nervous systems, digestive systems. But if these roots are not well tended to and nurtured, then the body can get out of balance. This is exactly what we're saying at the Center for Better Bones. You can't build bone health unless you build the health of the entire body. It's a systemic problem. And in functional medicine, we try to promote the well-being of the whole system. The functional medicine, just a couple simple bullet points would be, it's patient-centered care. Every patient is different. You treat the patient, not the symptom. It's integrated approach of the latest science with this nutrition lifestyle, with these more soft factors that we've known for a long time. And it integrates the best medical practices and the best medical tests. There are some fascinating tests coming down the pike. You'll see, for example, now they can look at the microbiome. They can take a stool sample and tell you which foods are going to spike your blood sugar. And pretty soon they'll take a stool sample and tell you which antibiotic to take, because the bacteria are the ones that metabolize that, or which other medicine to take. We have underestimated the importance of this bacteria, and I've constantly kind of measured, be sure to eat fermented foods, your yogurt, your sauerkraut, take the probiotics. We want to have healthy fibers. We need to have great digestion and great microbiome. But you'll be hearing a lot about the microbiome because it is very important to our overall health. So I was impressed at these sessions. Of course, they talked about lupus and diabetes and multiple sclerosis, rheumatoid arthritis. At this conference, there were several doctors who'd healed themselves from these disorders and with this natural approach, and that's how they got into it. It's largely natural, but they also use certain specialized medicines, I should say. But the conference, the session that most interested me was one by this Dr. Ewers, who really talked about stress and autoimmune disease. And she herself had a situation of rheumatoid arthritis that she was able to totally overcome with this lifestyle nutrition program, this comprehensive functional medicine, knowing actually what your biochemistry said, knowing what your lifestyle said. And she really reminded us that these stress factors, that your attitudes, your beliefs, worries, negativity, all this kind of negativity we can carry around, really can be a very big factor in creating autoimmune disease. All in all, it was really a wonderful session. There is some beautiful materials they're giving to doctors. I will share some of that with you as we go along this year. But most of all, to see that the doctors are finally paying attention to all these factors we saw which were so important: lifestyle factors, nutrition factors, special biochemistry factors, even emotional factors. And one of the things, if you're ever interested in a functional medicine doctor, this institute, the Institute of Functional Medicine, has directories, and you can just type in functional medicine doctor and see who's in your area. Doctors and nurses and nutritionists have to qualify to call themselves functional medicine practitioners, and if you have the luck of finding one, you might find that they help you a great deal with your bone health and other concerns. The last thing I want to mention to you is I'm happy that medicine is moving our way, moving to an integrated systemic approach. If you're interested in bone health and you want to kind of spend just a few days focusing on your bone health in a really concentrated way, working with me and all of my assistants to help you maximize bone health and help you understand the entire Better Bones, Better Body program, then I suggest you look into our Sedona retreat, early November. We have about 5 or 6, 7 slots left. It's a very small group because I work with every client individually. You'll learn the whole Better Bones program, and you will be on your step to functional medicine. It's fun talking with you. Talk to you all later.